I'm Dr. Kim. I'm a periodontist in Southern California. And today I have a really exciting product to introduce. This product is called DENOPS, Dentis No Pain System. It is a digitally calibrated injection system whereby the standard carpule of anesthetics and the needle is used, but it's a digital technology that allows slow, pressure-sensitive syringe action, including aspiration for safety, and you can calibrate the speed, the strength, and the amount of anesthesia you can give through this device. One of the main fear factors for patients in dental chair is the anesthetics. There's no question about that. And even amongst the most seasoned clinicians, the calibration of how well you inject, the speed and the pressure that you introduce could be interpreted as great versus awesome versus terrible, depending on the patient and the clinician. So this device allows a very careful speed and the pressure of anesthetic delivery that the clinician simply has to rely on the digital technology. So today we'll show you how this is put together, and we'll demonstrate the use of this device on an actual patient. The DENOPS digital anesthetic unit is designed to sit in this cradle, which functions as a charging device. This unit is surface disinfected in the standard way, and this is the cartridge holder. The cartridge holder is designed to be autoclaved. A standard carpule of anesthetic is inserted into this holder, as well as the needle that is twisted and secured into the end, as we do in the standard anesthetic syringe. Once the needle and the carpule is inserted and secured within the carpule holder, we join this unit to the main device. It is a simple twist action, and when the switches line up, then the assembly is ready to be used. We are going to demonstrate the use of the DENOPS digital injection system on a patient, pressing the power button. So the LED prompt shows me that we are in a functional mode. I will be aspirating. That was the actual aspiration. And I have now activated the device, and we are seeing the gauge. This was preset for 1/4 of a carpule at speed of 1 setting, which is the slowest speed. Therefore, we can be assured that there's minimum discomfort at this point. The last digit on my right of the screen says U1. It's a user 1 setting. As I was talking, we are at about halfway through now. The big syringe symbol has with the numerical numbers dropping, literally is drop by drop, and it does take some time, and I guess this is one of the beauties of this device. Most clinicians are guilty of doing this quite rapidly, which does add to the pain factor. We are at 75. Okay, so now I'm going to aspirate to be on the safe side. The aspiration is complete, and we are going to withdraw now. The DENOPS digital injection system has the main device, the carpule holder, where the carpule and the needle goes in. So the assembly is pretty straightforward, as in any conventional syringe system. The needle is attached to this end, and of course allowing the inner part of this cylinder to have the needle protruding in. The carpule is slipped in, making sure that it penetrates into the actual needle. Now this assembly is to be brought together to the actual device. By twisting this in, it's secured, and the buttons are covered with this sterilized component. The power switch goes on, and there is a vocal cue, and you can turn that into English, Korean, or Chinese. The main LCD shows exactly what we are doing here. This carpule looking prompt says 100%, which means that's how much anesthetic we have. We are targeting to place 1/4 of the carpule in this injection, and I have set it at 1 speed. The speed ranges from 1, 2, and 3, and 1 is the slowest and therefore the least uncomfortable. And we can have different user settings for your favorite settings. This is a U1. You can change these settings by pressing this button, and as the blinking goes on, you can actually move on to different settings. Once the needle is capped and the syringes are in the right place, you carefully remove the cap, and this forward button is what allows the actual injection to happen. But many times, once we are in the tissue plane, we do need to aspirate. The positive aspiration has to be ruled out so that we know we're not in a blood vessel, and this backwards button does exactly that. Therefore, I'm safe to proceed. When I demonstrate by pressing the forward button, you'll see that the drops of anesthetic is being delivered little by little, and I can stop it at any time. A very simple yet innovative design.